Imagine going to a med spa to get a routine IV therapy treatment and never coming out. That's what happened to a mother of 4 children at a med spa in Texas, who became unresponsive and ultimately died shortly after her IV treatment was started. While all procedures can carry risks, there are several red flags in this case that make this a tragic and preventable event. First of all, the woman who owned and ran this med spa and performed the treatment, Amber Johnson, was completely unlicensed. She wasn't a nurse, she wasn't a doctor, she wasn't a physician assistant. This is totally illegal. Second, the medical director who's supposed to oversee the operations of the spa was 100 miles away. He ultimately got his license suspended for failing to provide adequate supervision and oversight for the med spa and allowing an unlicensed person to practice medicine. But what ultimately caused this patient's death? Here's what I think are the two most likely causes. The first possibility is that during the insertion of the IV, air was introduced into the IV tubing, which ultimately made it into the bloodstream. This is called an air embolism. Although even very small amounts of air into the bloodstream can be fatal, usually it takes about an average of 20 milliliters of air to cause symptoms, which is about half the size of a shot glass. And usually it takes about 150 milliliters of air to be fatal, which is about half of a Coke can. So it may seem unlikely that this much air would get into the bloodstream to kill this patient, but remember, the treatment was performed by a completely unlicensed professional with likely very little medical knowledge, so I wouldn't completely rule it out. What I think actually may be more likely is the composition of what was in the IV fluids that were being given. According to reports, the contents of the IV fluids given to the patient included vitamin B complexes, vitamin B12, ascorbic acid, electrolytes, and TPN. TPN stands for total parenteral nutrition. It's a special method that we use to feed a patient through their veins when we cannot give them adequate nutrition through oral intake and utilizing the gastrointestinal tract. The contents of a TPN solution usually contain carbohydrates, amino acids, fats, and electrolytes. And one of these electrolytes is potassium. If TPN is given inappropriately and high concentrations of potassium are used, increased levels of potassium can actually stop the heart and create cardiac arrest. After all, it's one of the products that we use in lethal injections. So using TPN in an otherwise healthy patient at a med spa is one red flag, and potentially having an unlicensed professional put increased amounts of potassium into the solution is another red flag, which may have ultimately killed this young lady. So what are the take-home messages here? One is that even the most simplest appearing elective aesthetic procedure can be fatal if performed by someone who is unlicensed and untrained. So please do your research before undergoing any procedure and don't be afraid to ask for the treatment provider's qualifications. The aesthetic industry is truly turning into the Wild West. The bottom line is, as physicians, we need to avoid renting our licenses out to completely unqualified people just to make a quick buck. I'd like to know what you think of this unfortunate situation. Let me know and don't forget to follow for more.